Hello friends. So in today's video, we will be discussing a news item that is National Medical Commission's new regulations. Okay. So National Medical Commission, which is a body which has recently replaced the Indian Medical Association, this body has given certain guidelines on what doctors can do or how doctors can treat, whether they can refuse to treat or whether they have to treat the patient or not, what kind of medicine they are supposed to give. All such guidelines has been mentioned. Okay. What will be their duty in terms of telemedicine? All these guidelines have been provided by National Medical Commission. So we will be reading National Medical Commission's guidelines today. Okay, not the analysis part. Today we will be discussing only regarding the guidelines. Okay, so let us begin with the video. So let us begin with what is in news. Okay, so the National Medical Commission, it says that doctors may refuse treatment to abusive, unruly as well as violent patient as well as their relatives. So if the patient himself or herself or their family members or relatives, they are either abusive or unruly or violent, okay, in that case doctor may refuse treatment to such patients. Additionally, they must prescribe generic medicine. So in today's video, we will be seeing what are generic medicine, but the guideline says that they must prescribe generic medicine. Okay. The third guideline says that they may use social media only to educate. Okay. That means they can make use of social media to provide certain information. How to treat such conditions, how to, what can be the first aid in such conditions. All such kind of educative, informative informations can be posted by doctors on social media, but they cannot make use of testimonials or they cannot make use of scanned reports of patient to promote themselves. Okay. So again we will be reading this in detail, and another guideline says that no doctor can deny birth control measures or abortions due which are based on religious belief. So there can be certain religious beliefs which says that abortion cannot be conducted, should not be conducted. Okay, so the doctor must not deny abortion based on the religious belief. That is what is the news item related to National Medical Commission. So let us discuss these guidelines one by one in detail. The first guideline is regarding social media. It says that doctors cannot paste scanned reports online because it will affect the privacy of the patient. Okay. Any scanned report is the private information of the patient. If it is subjected to online content or posted on social media, it becomes a content of the social media owner. Okay, or it also becomes a content of the public. In that case, such data no more remains private. So that is a problem. Okay, so regulation says that doctors cannot paste scanned reports online, or they must also refrain from sharing testimonials by patients. So if patient has been treated by doctor and the doctor himself in their own social media page, they are trying to put up statements coming from patient that, see, I went to this doctor and such cure was done by the doctor. Such kind of testimonials, okay, be it written or video, such should not be posted by the patients, should not be posted by the doctor. Doctor must refrain from doing so. Okay. Also, such guidelines forbids doctors from purchasing or soliciting patients. That means they cannot ask to like, share or subscribe. Okay. That means there should not be any element of advertisement from the doctor side. Okay. If they want, they can make use of social media, as we have read earlier, only for educative purposes or for informative purposes. Some information can be provided or some education can be done by these doctors. Okay. Next regulation is on prescribing medicine. It says that only approved and rational combination of fixed dose combination drugs. Okay, these are also known as FDCs, fixed dose combination drugs, if and only if it is approved, plus it is a rational combination, only in that case it should be prescribed. Also, doctors must prescribe generic medicine. Generic medicine must be written in the prescription in legible as well as capital letters. Okay. Doctors need not prescribe generic medicine only if in case of narrow therapeutic index. So what is a generic medicine? Let's say A is a generic medicine. Matlab, that means it has replaced another medicine B, which was very costly. Okay. Now, with almost similar or almost no difference, with it can be substituted with a separate chemical. Okay, separate pharmaceutical input can be given to constitute A, which behaves in an equivalent manner as that of B. Okay. So A can be used instead of B. Only in that case we will be calling it as a generic medicine. Okay. Now, what do we mean by narrow therapeutic index? Narrow therapeutic index matlab, even with a small change in any of the input, this replacement is not possible. Such medicines are known as narrow therapeutic index. Matlab, you cannot replace or change any of the ingredient in terms of quantity or quality. Only and only that medicine should be used. Such medicines are known as narrow therapeutic index. So if such medicines are to be prescribed, then they must be prescribed. Instead of them, we do not need to prescribe generic medicine. But other than that, generic medicines can be prescribed. Okay. For example, the common example is paracetamol instead of dolo. So, dolo is not a generic medicine, paracetamol is. Okay. So, doctors must prescribe paracetamol instead of dolo. This is mostly because India is one of the largest producer of generic medicine. If we start prescribing generic medicine, generic medicine will be consumed by public. Okay. The guideline says that doctors must also educate people that generic is same as the branded medicine. Okay, because it is same as the branded medicine, so even if they are provided with generic medicine, they will be equally treated or they will be treated in a similar manner. That is what is the idea here. Okay. Now, the next regulation is in regards to refusal. It says that if the patient or the family members are either abusive, unruly or violent, then the doctor can deny treating such patients. Doctor can also deny if the patient is not able to pay the consultation fee, and the consultation fee must be informed to the patient even before examination or the treatment itself. So, the patient must be aware of the consultation fee, and if in that case the patient is not capable of paying, then the doctor can deny such kind of treatment. Okay. But denial should not be done. Doctor must not refuse in case of a medical emergency. They must treat the patient in that case. Okay. The next regulation is related to continuous professional development. Continuous professional development says that the doctors must keep training themselves, keep learning themselves. Okay. And in that manner, they have prescribed certain guidelines. It says that the license renewal will be done every 5 years. So, with respect to license of practicing, registered medical practitioner, okay, we call them RMP. Okay, so this registration has a license value, and this license will now be limited to 5 years. Now, if you have to renew the license, you will have to earn the credit points, and that is 30 credit points in 5 years. So, this is on an average 6 credit points per year. So, that is what the government is saying, or the National Medical Commission is saying, that ideally it should be 6 credits per year, but minimally it should be 3 credits per year. Okay. Also, NMC says that not more than 50% of such training should be done online. Matlab, they are supposed to take the course in general offline. And it is also applicable to professors of medical college, even though they are in continuous touch of studies, continuous touch of academics, still it is mandatory for them to take up these credit points. Okay. And once they have taken such credit points, so every such degree or diploma or recognized course must be added, shall be added to their unique ID. Okay. So, it will be displayed wherever the doctor's name is displayed. All such degrees and diploma shall be displayed along with the doctor's name. Okay. And such recognized CPD is continuous professional development, can then be added to the visiting card, or any such suffix which has to be added there, it can be added. Okay, once the CPD has been earned. Now, it also says that such CPD must not be sponsored by pharma company, because in that case, the doctors are liable, or doctors will be bound to prescribe medicines from only these pharma companies. So they do not want doctors and pharma companies to bind amongst themselves. They says that the NMC says that doctors can prescribe medicine from any pharma company, right? To de-link between doctors and pharma company, it also says that guidelines have been issued for continuous professional development institutes, and such institutes should not be funded by pharma company. That means here also, those institutes which are providing continuous professional development, they should not be linked to any pharma company. And doctors must not take neither doctors nor their family members are allowed to accept any gift, be it cash or kind or travel or TV or any substance. Cash or kind, no such gifts should be accepted by doctors from these pharma companies or their medical representatives. Okay. So with that, we come to the end of these regulations. Now, as and when the analysis of these regulations come up, we will continue discussing this topic. Okay, with that, we come to the end of this video. Thank you so much and all the very best.